Hi, this is Dr. Paul, and we're talking with Dr. Garrett Bode, chiropractic physician right here in Oldsmar, Florida. And the topic we're talking about today is how Dr. Bode helps spinal disc herniations. And Dr. Bode, you see quite a few spinal disc injuries, don't you?
Absolutely. It's one of the most common things we see here in the office.
Now, let me ask you, first of all, when somebody injures their disc, what exactly happens?
An injured disc can be injured in a couple of different ways, by the misalignment of a vertebra or from a trauma, say a car accident, a whiplash type injury. But typically what's causing a disc injury is where the bones of the spine have shifted in such a way as they've caused a damage to the disc that resides between those two bones.
Mm-hmm. Okay. Now, let's say that's the case. There's a disc injury.
Okay.
And what can you do to help it now?
The best therapy that we have found is a type of therapy called spinal decompression. Spinal decompression is a type of therapy that removes the compressive forces on that disc to alleviate the pressure on it, and therefore allowing that decompression of that disc to alleviate the symptom.
If you don't mind, walk me through. Let's say I have a disc injury, okay, and you're going to use spinal decompression on me. Okay, what are you going to do? What's going to happen?
The first thing when a patient comes through is, most of the time when patients come through and they've had a disc injury for quite a while, they've usually had some type of radiological examination or something that gives us an exact level. But when they come through our door, the first thing we're going to do is do an evaluation. Once we determine that they are in fact a candidate for decompression, we'll take them back into the decompression room. Mm-hmm. From there, we put them onto a specific table that does a specific action to alleviate that disc. With decompression, what you're actually doing is pulling the spine apart in an axial position, meaning if you were using me as an example, it would be like pulling my head upward and pulling my waist downward.
Okay, let's say I have the disc injury. How are you going to do that?
By the table that we have.
Okay.
The table specifically, it's a very specific table called a spine med table. Mm-hmm. By laying on this table, you can hook the hips of the patient onto this table with two padded pieces of therapy or parts of the table.
Okay.
And by hooking this onto the hips of the patient,
this is a specially designed table.
Absolutely.
This is not just a flatbed therapy table.
No. This is a specific table made specifically for disc injuries. And it's a very highly technical piece of equipment.
So let me understand. Am I laying face up or face down?
You're laying face up.
Okay, I'm face up, and I've got the support at my hips. Mm-hmm. Okay, now
you have another strap that goes around the top of you.
Okay.
That point is to hold you in place, while the port that's on your hips, or the part that's on your hips, pulls downward.
Okay.
And by doing so, the top body is held in position, but the lower half of the body is being pulled downward. Okay. And in doing so, you take the pressure that is squeezing that disc together, creating all of that pain, and as you pull it apart, it gently pulls apart to alleviate that symptom. I was going to say,
this is slow and easy, isn't it?
Very slow and easy. Most of the patients, when we put on decompression, I go back to bring them off the table. Most of them are completely asleep because they're so relaxed. Mm-hmm. By pulling apart that table, and it does pull very gently, but by pulling apart, it alleviates that severe pain that patient is in and helps to give them a more sense of relaxation and relief.
Now, how do you know how much pressure to use to open that disc injury up? How much?
There is a specific protocol for the table that we have. There are different types of decompression tables. When we purchased our table, we wanted to make sure that we found the table that we felt had not only the best technique, but also the latest technology that would give our patient the best chance for help. But in doing so, to determine how much weight, it's based upon the patient itself. And typical protocol is to take the patient's total weight, divide it by 4, and subtract 10 pounds. That's your starting weight.
Okay.
So if you have a 200-pound man, you divide that by 4.
I got you.
Take away.
So that's where you kind of the start. And
that's correct.
And then go from there. Okay. Now let's say something goes wrong on the table. I don't like it. What happens?
Every patient, when we put them on the table, they are left in the room by themselves on the table, but they are left with one very specific thing, and that is a kill switch. If anything on the table during the treatment begins to become uncomfortable or gets to the point where the patient feels it's not right, they can stop it themselves by simply hitting that button. It immediately shuts off that table without any further action at all.
Does that happen very much? Do patients actually...
Most of the time, patients, when I go back there, if they've hit the kill switch, they apologize. Oh, doc, I'm sorry, I hit the button on accident.
Oh, okay.
I've yet to have anyone push it because they were actually having
So
discomfort.
it is a very comfortable procedure.
Absolutely. It's not only is it comfortable, but it's relieving the symptom while they're
Right.
on there. So it's, and for a lot of patients, if you've had a disc injury, you know that unrelenting, constant
yeah.
pain.
Yeah.
When you get any relief, most of the patients, I'm fighting to pull off of that table. No, leave me here.
Right.
You know.
Right.
So,
Well, that brings the next obvious question. When they come off to the table, wouldn't it just go back to where it was?
you know, for the longest time, this technology sat on the sidelines because of that very school of thought. Most people thought, well, yeah, you can pull it apart, but as soon as I stand up,
Right.
gravity's going to affect me
Right.
again and compress me together. What they have found through the research and the studies, where you find someone finally took the step to develop the table and do it, and did the studies, and what they have found is that does not occur. I've had probably 30 patients on our table in the course of the last 2 years. I've only had one patient that returned that said some of their symptoms returned. By putting them on the table for 2 or 3 more visits, their symptoms disappeared again. We have yet to have them come back into the office. We do tell patients, however, with disc injuries, if you go back to the activity that caused the disc injury in the
Right,
first place, your chances of it coming back are going to be pretty high. But whether you utilize spinal decompression, chiropractic therapy, or even surgery, if you don't take care of that injured disc, it's going to come back on you eventually.
Well,
in
is
the
it
future.
possible when you get to therapy that it actually heals right?
Oh, absolutely. It can heal properly, and when it does heal properly, it becomes a permanent fix.
Okay.
And decompression is meant to be a permanent fix, not just a temporary relief or therapy. It is actually a treatment meant to fix the problem on a permanent basis.
Okay. And how many therapies typically would it take? How many treatments would it take to...
The typical protocol with decompression is 20 treatments on the table itself. Myself and 4 other chiropractors went into decompression together, meaning that we all 4 went to several different seminars to determine not only what's the best table, but which one utilizes the best protocol and which one seems to be getting the best results. In doing so, the 4 of us chose one table, and each of us have been utilizing it in our offices. In doing so, all 4 of us came up with a protocol that we found worked best for the patient. That is 20 treatments on the decompression table itself. There are vitamins and supplements that we use to help nutrify the disc and help it to gain that nutrification and keep it healthy. There's a physical exam. After the 20 treatments, we will do 3 weeks of chiropractic care. Once you have that disc decompressed, you want to make sure that the bones surrounding that disc are in their proper position so they don't continue to irritate the disc and compress it right back. There are some belts that we use to give extra support. There's also a final exit exam and also a core strengthening set of therapies that we do with the patient to help them to make sure that
a lot
all
of
of
supportive type
absolutely,
therapies.
and all of them are utilized to make sure that the patient does have a permanent fix.
Right. Is this spinal decompression, is this the type of therapy that can prevent somebody from having disc and back surgery?
Oh, absolutely. I've had, like I said, of those 30 patients that I've had on this table, I want to say maybe 5 or 6 already had their surgery scheduled
Oh, wow.
and canceled it due to
is that
this
right?
because they got such good relief and such good results.
Okay. Well, that's interesting. All right, very good. Again, we're talking with Dr. Garrett Bode, chiropractic physician right here in Oldsmar, Florida. And the topic today, again, is talking about how to relieve a disc herniation, specifically what appears to be a very effective form of treatment, spinal decompression. So if you're having any disc injury or suspect disc injury, certainly give, or even if you're possibly looking at surgery, give Dr. Bode a call.